and welcome to the evening news. Thank you all for tuning in to Pathophysiology News Channel 10. We have an exciting lineup this evening, and we are here at the Human Body conducting live interviews with Mr. Pancreas and his friend, the disease process. First, we have Mr. Pancreas. Can you tell us a little bit about yourself?
My name is Mr. Pancreas. I'm from the abdomen and live near my friends' liver, spleen, and duodenum. All the ladies love that I'm pear-shaped. I'm about 6 inches tall and have 3 major parts: a head, a body, and a tail. Want to know an interesting fact about me? I am both an endocrine and exocrine gland. As an endocrine gland, I secrete hormones like insulin, glucagon, and somatostatin. As an exocrine gland, I manufacture and release key digestive enzymes like lipase, amylase, trypsin, and chymotrypsin, and I digest fat, carbohydrates, and protein. If I didn't do my job so well, the food you eat would not be broken down and you wouldn't digest it. Of course, sometimes I don't do my job the best, and bad stuff can happen because of it. I brought my other friends today to tell you a little bit about.
Now, here's where things get interesting. Let's start talking about some of the disease processes and see what they're all about. First, let's start with Miss Pancreatitis. She always has 2 sides to her story.
Well, I can be broken down into 2 classifications, acute and chronic. First, let's talk about my acute side. The most common cause of acute pancreatitis is biliary tract disease and alcohol abuse. Acute pancreatitis occurs more often in men than in women. When acute pancreatitis is caused by biliary tract disease, by an obstruction in the biliary tract disease, the cause is typically an obstruction in the pancreatic duct, preventing the free flow of enzymes from the pancreas. The backup of these enzymes in the pancreas causes autodigestion and will destroy the pancreatic cells. The obstruction could be caused by gallstones or for other reasons. I'm also commonly caused by alcohol abuse because the ethanol in alcohol causes intracellular accumulation of digestive enzymes, and premature activation of these enzymes can destroy the pancreatic cells. I tell all those heavy drinkers all the time, if you overconsume alcohol on a regular basis, there's a good chance you get to hang out with me, acute pancreatitis. Other reasons that somebody may suffer from acute pancreatitis is triggers from inflammation due to abdominal trauma, viruses, bacteria, and the presence of AIDS. I can often be referred to as acute interstitial pancreatitis, acute hemorrhagic pancreatitis, or the most severe condition, necrotizing pancreatitis. Necrotizing pancreatitis is the necrosis of the pancreatic cells and can be deadly. When I'm acting up in the body, many complain of acute onset of steady, dull abdominal pain, typically in the epigastric region. I will also cause the body to drop blood pressure, increase heart rate, feel nausea, and sometimes vomit. I can also cause abdominal tenderness and give the skin a little yellow color. Commonly, patients may present with colon sign, which is a bluish discoloration around the umbilicus due to bleeding in the peritoneal cavity, and gray Turner sign, which is red-brownish discolorization in the flank area, also due to peritoneal bleeding. You can tell the pancreas is acutely inflamed in the body when the blood level amylase is elevated and there's an elevation in serum lipase. The main way to treat my acute state is provide supportive care, decrease oral intake, treat my pain, and provide intravenous fluids. It is important to manage me and prevent systematic complications such as hypovolemia, such as chronic kidney disease caused by hypovolemia, acute respiratory distress syndrome, and cardiovascular complications like profound. When acute pancreatitis leads to permanent changes, my other side may come out, known as chronic pancreatitis. Chronic pancreatitis results after several episodes of acute pancreatitis, leading to cellular injury, pancreatic fibrotic cellular changes, and the development of scar tissue in the pancreas, causing dysfunction of the pancreas. Pancreatitis can become chronic when inflammation of the pancreas does not heal and leads to permanent damage. Similar to acute pancreatitis, the chronic state of me is caused by digestive enzymes attacking the pancreas. Causes of my chronic state include long-term heavy alcohol use, hereditary disorders, cystic fibrosis, hypercalcemia, hyperlipidemia, and autoimmune disorders. When I get into my chronic state, I may cause the blood I may cause the body abdominal pain that spreads to the back and is worsened by eating and drinking. Other signs that I have become chronically inflamed in the body includes the presence of nausea, vomiting, unintentional weight loss, poor appetite, diarrhea, and stertoria, which is a fancy name for fatty stools. You know, the ones that float, right? ERCP is the gold standard for diagnosing chronic pancreatitis. Treatment of me includes IV hydration, nutritional support, pain management, and supplemental digestive enzymes and insulin. If pancreatitis is a chronic condition, the body may want to consume small, frequent meals, cut back on adult beverages, and not puff on so many cigarettes. The ransom criteria is often used to determine the severity of my pancreatitis when I show up in the body. Complications of chronic pancreatitis includes hardened calcium salt deposits on the tissue of the pancreas, gallstones, destruction of the insulin-producing cells known as beta cells, resulting in diabetes, which I think you'll be doing an interview later with diabetes herself.
The next guest is someone you really have to watch out for. She is really deadly. Pancreatic cancer has a mortality rate of nearly 100%. The 1-year survival rate is less than 29%, and a 5-year survival rate is less than 5%.
The causes of me is really unknown, but the risk factors are hereditary disorders like mutation in the BRCA1 and 2 genes, smoking, obesity, diabetes, consumption of nitrate preservatives, and my friend who was on the show earlier, chronic pancreatitis. I can present in the exocrine and endocrine cells of the body of the pancreas. Ductal endocarcinoma and pancreatic tumors from exocrine cells occurs in the head, body, and tail of the pancreas. Tumors in the head of the pancreas can obstruct the common bile duct and the portal vein, causing a bile to back up into the liver. In addition, tumors in the body and tail of the pancreas can infiltrate the abdominal wall, invade the lymphatic system, and metastasize to the liver. Sometimes the body has no idea I'm even there because I often remain asymptomatic for a large amount of time. When I finally want my presence known in the body may appear jaundice or yellow due to bile duct obstructions. The body may also experience pain that often worsens at night, nausea, vomiting, weight loss, dark urine, and changes in the appearance of their stools. Some of the first signs of my presence in the body is a new onset of diabetes and venous thrombosis. I can also obstruct veins and contribute to the development of ascites. I often travel to other places in the body. In fact, I like to metastasize to the cervical lymph nodes, lungs, and brain. Corver's sign, which is the enlargement of the pancreas and a palpable enlarged gallbladder, is a sign that I may be present in the body. Virchow's node, which is the presence of a left supraclavicular lymph node, is also associated with the presence of me in the body. Blood tests, ERCP, MRCP, CT scan, and biopsy of the pancreas may also determine the presence of me, pancreatic cancer. Treatment for me includes pain management and surgical interventions such as a possible Whipple procedure.
We can't talk about the pancreas and disorders of the pancreas without bringing up at least a small snapshot of misdiabetes.
I'm misdiabetes. I result from inefficient carbohydrate metabolism, where Mr. Pancreas does not produce enough insulin, or the body is unable to utilize the insulin to keep blood glucose in normal range. You could say I get around. Approximately 25.8 million people in the world live with me, especially older people. I'm like the girlfriend you just can't get rid of. If this were the perfect world, glucose would stimulate the pancreas to secrete insulin and absorption of glucose from the GI tract. Then the glucose in the bloodstream would stimulate Mr. Pancreas' friend, the islet beta cells, to secrete insulin and facilitate cellular uptake of glucose. Of course, this isn't the perfect world, so that's where I come into the picture. There are multiple sides to me. I can be type 1, type 2, or gestational. When I first start coming around, you'll have a triad of feelings. I'll make you hungry, thirsty, and you'll have to pee. Sometimes, if my friend glucose is too low, I get irritable and like to make you feel that way too. I'll make you sweat, dizzy, nervous, tremble, have headaches, heart palpitations, confusion, and an inability to concentrate. Ways to know I may be occurring in the body include a fasting blood glucose of greater than 126 milligrams per deciliter, a random blood glucose test greater than 200 milligrams per deciliter, or an A1C of greater than 6.5%. I may also have glycosuria, which is a glucose in the urine that is not reabsorbed by the kidneys, or ketonuria, which is the presence of ketones in the urine. Treatment depends upon the part of me that you suffer from. Treatment for type 1 diabetes is insulin replacement, and treatment for type 2 diabetes varies from lifestyle modifications to anti-diabetic medications and insulin.
Wow, we've had quite a show for you today. Thank you to our guest speakers for being part of today's show. Make sure you take care of your pancreas, and it will take care of you in return.
That's all, folks.